This video provides information from the internet, and we do not promote any products or medicines. Always consult a doctor before using any medication. We are not responsible for any side effects or issues resulting from self-medication.
Apixavac 2.5 tablet is an anticoagulant medication. It is used to manage blood clots effectively. Indications and uses. This medication is indicated for the prevention and management of blood clots in adults, particularly those undergoing hip or knee replacement surgeries, patients with atrial fibrillation to reduce the risk of stroke, and in treating conditions such as deep vein thrombosis and pulmonary embolism. It also helps prevent the recurrence of these conditions, ensuring better blood circulation and reducing the risk of serious complications. How it works. It works by inhibiting clotting factor Xa, an essential component in the body's blood clotting mechanism, thereby preventing the formation of harmful blood clots. Directions for use. Take this medication as directed by your healthcare provider. Swallow the tablet whole with a full glass of water. If you experience difficulty swallowing, consult your doctor for alternative methods of administration. The correct dosage and duration of treatment will be determined based on your individual health condition, age, and body weight. Possible side effects. Common side effects include various forms of bleeding, bruising, anemia, low blood pressure, and nausea. If these symptoms worsen, it is crucial to seek medical attention promptly. Precautions and warnings. It is essential to inform your healthcare provider about any pre-existing conditions, especially liver or kidney diseases, prior to starting this medication. It is contraindicated in pregnant women and those with active bleeding disorders. The elderly and patients with heart issues should use this medication with caution. FAQs. 1. Is this medication a blood thinner? Yes, it is an anticoagulant that helps manage blood clot formation. 2. What precautions should I take? Inform your doctor about any existing health conditions. 3. What if I forget a dose? Take it as soon as you remember, but do not double up on doses. 4. Can it cause low blood pressure? Yes, low blood pressure is a possible side effect. 5. Is it safe during pregnancy? It is not recommended during pregnancy. Consult your doctor. Thank you for watching. If you have any questions or suggestions, please leave a comment below. Your feedback is always appreciated.